Welcome to Mission Imperfect, the podcast about finding your own path, your own way, and embracing the imperfection of the journey.
We're your hosts, life coaches, former HR professionals, and mums, Kirsty and Kathryn.
We love to discuss the topics that come up time and time again for our coaching clients and which affect us all, from things like acceptance and boundaries to values and well-being and everything in between.
Each episode ends with a question for you and us to reflect on. Your mission, should you choose to accept it, is to grab a cuppa and a biscuit and join us in getting lost in finding ourselves.
Hello and welcome to this week's episode of Mission Imperfect. We have another special guest episode today, and I'm joined by Dr RebeccaWilliams. She's previously worked as a GP for 25 years, so she knows her stuff, but she now works as a stress management specialist. So welcome to the podcast, Rebecca.
Thank you very much, Kathryn. It's lovely to be here.
It's great to have you on. I think this is a topic that we could really spend quite a bit of time digging into and talking about, which of course is going to be stress. So let's just start things off. What exactly is stress? Because I think it's a word we use quite a lot, right? We even say sometimes a bit offhand, "Oh, I'm really stressed out today," don't we? We'll perhaps use a phrase like that. But actually, it's something we could probably do with getting to grips with our understanding of it, and do we get it mixed up with other things like anxiety, for example? So if you could just shed a bit of light there on what do we actually mean by stress? What should we mean by stress?
Yeah, so I mean, that is a really important question. So ultimately, stress is what happens when the demands placed upon us exceed our ability to cope. And often stress is associated with anxiety and also with pressure, and people respond differently to pressure. So some people thrive under pressure, others find pressure stressful, but wherever you are on that scale, there comes a point beyond which that pressure becomes stressful. So anxiety is very much tied up with stress, but isn't the same. I think it's really important for your listeners to understand what's going on when they're stressed. So ultimately, it's all about the acute stress response or the fight, fight, flight response. So this is an evolutionary adaptation to life-threatening situations, which is all about maximizing our chances of survival. So when we're in danger, the most primitive part of our brain recognizes this and generates a response. It activates the systems that are needed to make us fast and strong and alert. For example, our heart rate goes up, breathing rate goes up, our muscle tone increases, making us stronger, and our senses become more alert. But at the same time, it suppresses those systems which are not needed and which would be a waste of important energy. And that includes our digestive tract and, very significantly, the front part of our brain in the prefrontal cortex, where our higher functioning occurs. So this is where we do our rational thinking, where we make decisions, solve problems. It's where we take in, process, and remember things, and it's where we control our emotions. And once the danger has passed, or we fought it off or run away, everything goes back to normal. And that's how it should be. And that amazing response still saves our lives today. However, the brain can't tell the difference between a life-threatening stressor and the other stressors that we face in life. So it still generates this same response to a greater or lesser extent. And that is why it becomes a problem, because there are many, many physiological changes in our brain and our body during this stress response. And if those are then maintained for days, weeks, months, even years, it doesn't take much to realize how that's going to affect our health and our functioning.
Yeah, absolutely. So yeah, we've got this short-term response that's helpful, but when it becomes long-term, it is actually going to impact the way in which we live our lives. So
Yeah.
what is the harm? I guess we're calling, would this be fair to say is what we call chronic stress?
Yes, I suppose so. I think, yes, prolonged stress, chronic stress. The harm can be enormous. And certainly as a GP, I had quite a few patients coming in with physical symptoms that when we talked about things and I checked them over and then they told me everything that was going on, it became apparent that their symptoms were caused by stress. So we know that stress can cause a whole variety of physical symptoms, from different kinds of headache, like tension headaches, migraine headaches, to sort of tension in the neck and the back and other muscles, to chest symptoms, abdominal symptoms, skin problems. I mean, the list goes on and on with the different symptoms that stress can cause. It can also contribute to chronic health problems. We know that stress plays a role maybe in some cancers, but also in autoimmune conditions. because the stress response affects our immune system. It also can lead to a rise in blood pressure. And I had a patient who came in once with headaches. I took his blood pressure, it was through the roof. And when we started talking, he admitted that his work situation was toxic. And ultimately, in his case, actually, he left his job and his blood pressure came back to normal. So, and then rise in blood pressure can go unnoticed. People can end up having heart attacks, strokes caused by stress. Again, one of my clients had a stroke caused by stress. So, yes, the physical impact of stress is enormous, but it can also affect our mental health and our emotional health, and also through the unhealthy ways in which we cope with stress, which I know we're going to come on to a little bit later.
Yeah, absolutely. And it's a difficult one, isn't it? Because I can see it can become, or I imagine it can become a bit of a cycle because we're experiencing stress, it's having an impact, and then we might respond to that in a certain way that's not helpful, maybe even exacerbating the stress. And it can become something of a loop that I can imagine can be quite difficult to get out of.
Yes, you're absolutely right. And that's why I'm so passionate about it, because often once people start on this trajectory, they end up kind of going downwards. Because if you imagine, if you're struggling with stress, as I've said before, you find it harder to concentrate, you're more likely to maybe make mistakes, to forget things. That impacts on your confidence at work and at home. You're more irritable and short-tempered because you can't control your emotions. That affects your relationships with colleagues, clients, children, partners. So then all these other areas of your life start to become stressful as well. And then, as you've said, you start relying on unhealthy ways to deal with it because you're unable to think clearly. So you're doing what feels like the right thing in that moment, but actually, in the long run, it actually causes you more problems. So, yes, it is very dangerous in that respect, which is why I feel it's so important for people to understand what stress means for them and then know what they can do to reduce its impact.
Yeah. And I imagine another reason why it's difficult is because there isn't sort of like a universal cause, I guess, for stress because people have probably their own individual thresholds. Like you were talking about at the beginning, what
Mm.
someone might find stressful, someone else might find exciting, or like a deadline, for example. Someone might find
Yes.
that really daunting, someone else might really thrive in that kind of environment. And then there's all sorts of different things that could be a contributing factor in our modern lifestyle. I mean, I imagine probably are some common things that you see do crop up, like perhaps work-based pressure or something like that. But otherwise, it could be a number of things, right, that are contributing to people's stress levels.
Absolutely. And ultimately, it is a unique experience for that individual. And therefore, we have to be very careful about judging other people's stress because we don't actually know. All the different
Yeah.
factors come into play, like personality. And some people, often stemming from childhood, have developed kind of perfectionist and people-pleasing tendencies, which can make them more vulnerable. A lot of self-worth issues, people lower in self-confidence, that can affect their perception of situations. We've got relationship issues, we've got health issues, bereavement and grief. As you've said, anxiety, sort of a tendency towards being more anxious can make you more vulnerable. And then workplace, yes, there can be a whole variety of different things in the workplace. And remember that if someone's got things going on at home and they're not dealing with the stress in a healthy way, then they will become less able to cope with their work demands. So what was maybe previously a manageable workload becomes unmanageable because, as I've said, they're struggling to think clearly, to remember things, to make decisions. Everything's taking longer, and they're not getting on top of their work deadlines. And people may also lose confidence and start getting more anxious, so double checking things, having to ask people things. So yes, it's very complex, and that's actually why I love doing my one-to-one sessions with people, because we have the chance to really get to grips with who they are as a person, maybe help them understand why they behave in a certain way, and give them tools to help them do things slightly differently. And sometimes, certainly, when it comes to events that have maybe happened in their life, it's just giving them that space to explore these events, whether it's marital or relationship splits, or whether it's health issues, or whether it's bereavement, giving them that space to explore their feelings and to just have a bit of healing, which can then help as well. So
Yeah.
yes, it's
So, and talking about this sort of slightly tricky loop that people can find themselves stuck in, I imagine part of that loop is some of this unhealthy coping behaviors that perhaps people have adopted, whether they've attributed any of it to stress or not, because it could be that they haven't made that connection,
Yeah.
but they've got a sort of coping behavior that's actually not helping them break out of that loop. If anything, it's helping it feed back round again. Can you tell us a little bit about what some of those unhealthy coping behaviors might look like, so people might be able to think, is this
Yes.
something that I do? And I'm going to be very
Yes.
interested to hear this myself in case any of them are true.
Yes, and actually this is really important because, as I've said, people reach for things to make them feel better in the moment, and sometimes that is the first warning sign that they have, oh my goodness, I need to stop and look at myself. So examples are smoking, and in fact I had a client the other day who apologetically admitted to me that he'd restarted smoking because of massive issues in the workplace, and I've seen that many times with patients in general practice. Alcohol. People use alcohol for all sorts of things, including trying to help them sleep, which unfortunately isn't good because it's not a proper, good, healthy sleep. They use it to calm nerves. And I had a patient once who I knew as an alcoholic, and he admitted that he had started drinking as a way of calming nerves before doing public speaking. And he hadn't really noticed what was happening. He just felt better drinking, and then it destroyed his life and killed him ultimately in his 50s. So the alcohol is a common one. People also use alcohol as a treat at the end of a day or to help them relax at the end of the day. And again, I had a client who realized after a month that she'd been coming back and having a glass of wine every day and suddenly thought, oh, hang on a minute, I need to change this. So that helped her sort of take stock a little bit. Another one is overeating, the classic sugary, fatty foods, which make us feel good in the moment. Which then which can affect our energy levels through the day. They can affect our sleep because sugar spikes before bed may prevent you sleeping well. And they can also cause weight gain and other image issues, which then lead to a loss in confidence, which make things worse. And then caffeine. Caffeine I've come across quite often with people not sleeping well. So they start drinking more caffeine to get them through the day. And that leads to ups and downs and also can lead to worsening their sleep because caffeine stays in the body for it takes 8 hours to halve its dose. So a mug of coffee takes 8 hours to become the equivalent of half a mug of coffee. So it lingers a long time. The other classic that people do is and we understand why, but is to work evenings and weekends, is to sacrifice their downtime because they think I've got so much to do, I've just got to do it and get on with it and get it done. But remember when I said that when we're stressed, our higher functioning is not working properly. So we find it hard to think clearly, to make decisions, all these things. And therefore, that's why things take longer, because we're finding it hard to concentrate. We're having to double check things, make sure we haven't made mistakes. And therefore, things take longer. So that's why people feel that they need to keep on working into the evening, the weekend. But actually, it's the worst thing that they can do, because the reason things are taking longer is because they're stressed. They need that downtime to rest and recharge. And if they actually are consciously making that downtime a priority, they'll probably find they become less stressed and function better and are actually more productive and better at their work. So those are a few of the really common ones that people do. Also, people end up on their phones, doom scrolling. That's a very common one as well. And that can actually worsen anxiety and negative thinking as well. So yeah, there's many things we do that actually just make things worse for us.
Yeah, hence the loop continues as we've just been talking about.
Yes.
But I want to give people a little bit of hope. So what
Yes.
can people do to perhaps, because I think some of those behaviors you've just mentioned, I think we can probably all identify with
Yeah.
one or more of those at various points, whether it's now or in the past, or potentially it might come up again in future. What can we encourage people to do to help them recognize that they might be in a sort of loop here where stress is a factor that perhaps they haven't really entertained? You know, for example, if it was a headache that you mentioned, that could be a sign of something. All they've thought is, oh, I get headaches, I'll quickly take the tablet, and they carry on with all of the other, stress enhancing behaviors like working late and so on. How can we help people to identify that stress might be a factor at play here? And then I think we can come on to some better ways to help manage it. But how do we help people encourage
Yeah.
the
It's
identifying
a
part?
really tricky one, that, because as you say, when we're stressed, we lose our perspective on the world and we're just
Yeah.
very focused on the matter at
Yes.
hand. So one thing that I think is really important is self-awareness. So it's understanding ourselves. It's actually when we are feeling okay, stopping and thinking, right, okay, what kind of things happen to me when I'm stressed? What are my unhealthy ways of coping with stress? So the more you're consciously aware of that, the more you are likely to recognize it as a sign. I had a client once who knew that tension in his left calf was his first sign of stress. So when he developed that, he stepped back and looked at what was going on and made adjustments to the way he was living. So I
I've
also
never
had a
heard
stress.
that. That's
Yeah,
so specific. The
well,
left
it
calf.
is,
I mean,
and this is what exactly.
is that
That's
was that surprising to you to hear that? Because I can't imagine many people would, the headache, I can kind of imagine, right?
yeah.
Because we've been talking about different parts of brain and even like the gut and things like that. I can kind of see a kind of connection, but a random part of the body just seems a bit strange. But
Yes,
is it
but
still
what
plausible?
it is totally plausible because actually, if we remember me talking about the stress response, one of the things that the body does is increase tone in the muscles so that we can run, so that we're
Yeah.
strong. So therefore, it's very common for people to get tension in their neck, in their back. And people can get pain here caused by tension by clenching their teeth without realizing it. So in theory, any part of the
Mm.
body, muscular tension might be an issue. So it was unusually specific and localized for him,
Yes.
but it does make sense. And in fact, many stress symptoms make sense when you think about change in
Mm.
physiology and what it's designed to do. Um, so yeah, so I actually have created a stress self-check-in tool, and it's in one of the blogs on my website if people are interested, and also my little book here, which is designed around it, dealing with stress the mind, body, spirit way. But it revolves around three questions. One is, what are my stressors at the moment? What's making me feel stressed? Number two is, am I relying on any unhealthy ways of coping with my stress? And number three is, am I getting any symptoms of stress? And then the rest of it is all about giving people tools for each of these areas. But I recommend to people that once a month they just block out even half an hour with a cup of tea or a cup of something, and they just ask themselves these questions. And that enables them to reset in a rational way rather than ending up in a crisis situation and then realizing, oh my goodness, I'm stressed. So, yes, if you're self aware enough to know what your signs are, then hopefully you will notice them. But if you don't feel, if you're worried about them, then I think ask yourself the questions once a month, and then that just gives you an opportunity to reflect and reset. And then you're less likely to end up in this spiral that we've kind of talked about.
Yeah. Oh, I love that. And we'll put a link to that in the comments. I really like the sound of that. Obviously, as a coach, I'm a big fan of questions. And a thought just occurred to me. I wonder if this sort of moment of reflection and asking yourself some questions, I'm a big fan of that. And I just wondered, does that encourage you to access the prefrontal cortex, or is that a connection that you're able to do when you just take stock for a moment and ask yourself some questions?
Um, it depends what state of mind you're in. So if you're literally
Yeah,
feeling really, really, really stressed, you're not going to get very far
you're
with
not going to
it.
access.
So that's where you would have to do things to help you feel calmer, and that's where we come on to say grounding tools. So I can talk about those now if you like,
Well, no,
because we've
absolutely. Well,
come to
let's
it.
talk about some good ways or some helpful
Yeah.
ways that people might be able to manage stress, because we've mentioned symptoms that might be starting to be evident for people, whether they're physical ones or perhaps irritability, I guess, might be another one, or being a bit more tearful than usual, something like that
Yeah,
could
well, I
be.
can run through a few of them because we have to
Yeah.
remember that stress affects our mental health. So you might find you're getting more anxious about things. You might find you're
Mm.
catastrophizing, getting fixated on a worst case scenario, that you're struggling to concentrate, that you're making mistakes, or getting, as you say, getting irritable and short-tempered with people, maybe more tearful. You may notice physical symptoms, and you may just notice that you're not sleeping very well, that maybe your appetite's gone again. One of my clients earlier this week was saying his appetite was way down. So yes, again, you may start to notice change and recognize that those as warning signs for yourself. And I think I might quickly, just so we don't forget, touch on ways of trying to have an alternative to the unhealthy ways of coping with it. Because I think the first thing is if you are reaching for a glass of wine or a mug of coffee, whatever it is, ask yourself why. Why am I reaching for wine? Is it because I'm stressed? Is it because I'm anxious, lonely, bored, tired. If I'm reaching for coffee, am I tired? Um, so ask yourself why, and then try and address those reasons directly. So if it is because you're tired, then maybe really look at advice on how to get a good night's sleep. If it is because you're anxious, try and get some advice on how to manage anxiety. And certainly there's some blogs on my website that can help with that, and managing anxious and negative thinking. So asking why is really important. And the other thing is to have an alternative. And this is where I talk to clients about simple joys. So simple joys are the things you can do in a few minutes that help you to feel better, but which don't cause you harm. So these are very personal. So the examples I've come across or do myself are watering your pot plants, watching birds on a bird feeder, playing a musical instrument like the piano just for a few minutes, flicking through your favorite magazine. It's very personal and something to ask yourself, what makes me feel good, which I can do in a few minutes, which doesn't cause harm. And then instead of reaching for the wine or the cigarette or whatever it is, try and train yourself to reach for a simple joy. And they can be useful rewards as well. If you're doing something that's hard, you can break it down, and after each chunk that you've done, you can then have a little simple joy. And they can also just be a useful way to disperse them throughout your day so that you're just having little pick-me-ups regularly, but again, they're not causing you harm. So
Yeah.
those are hopefully useful.
Oh, I love that. And what I also like about that is almost like we'll all have something, and it doesn't have to take a lot of time, doesn't have to cost a lot of money, and it's something that's going to be around already. Like the book you could just reach for and read a few pages of, or something like that. There'll be something. I love the examples you gave. Like the bird table, the pot plants, the musical instrument. There's going to be something that's going to be around for everybody, that's accessible, because that's what we want, isn't it? We want it to be something that there isn't really an excuse not to. In a way, you just know there is something available that you can have a try at and just see how it works for you. And I like the idea of doing it perhaps even at regular intervals, almost like as a, rather than waiting for something to require it, you perhaps build it in. Do you think that's also a good practice?
Absolutely. I think, yes, I do. I do, because I think it's a regular pick-me-up.
Yeah.
Yeah, I think that's a
Excellent.
good thing to do. And
Well, I
that's
think
obviously
you've
the simple joys. Obviously, there's if we're thinking about other ways of trying to build your resilience, then you've got other things that give you joy as well, which maybe take longer, which you can allocate time to, whether it's hobbies or spending time with people that you like, and that can be helpful too.
yeah, absolutely. And I think you've got an acronym, haven't you, for another means of helping ourselves to manage stress?
I have. Do you mind if I just step back and talk about grounding tools first? Because I realize we've
Yes, of
touched on it and
course.
then I haven't done that yet. So I'm going to give people an analogy that might help them to understand. So if we think of a kettle, now say you've come to the kettle and you want to make a cup of tea, and the water is really, really hot, but it's not quite boiling. So you press the switch, and literally very quickly the water reaches boiling point, and you can make your cup of tea. Conversely, you come to the kettle, there's no water, and it's cold. So you fill it with cold water, you press the switch, and it takes much, much longer for that water then to come to the boil. This is a really good analogy, because if we are running on stress, if there's a lot going on and we're overwhelmed and we're not coping well with life, it doesn't take much to push us over the edge to a place of completely just feeling like we're not coping. On the other hand, if we recognize recognize our stress, and we have the tools, and we nurture our sort of self nurture our health, then we'll be more resilient, and therefore it takes a lot more to tip us over the edge. So here we've got two areas where we need to invest. One is in grounding tools. Now the grounding tools are useful for bringing you from the boiling point back to just below boiling point. So in other words, from a place of overwhelm back into a place of rational thinking. So from your stress brain back into your higher functioning brain. So examples include breathing. Often when we're stressed, we breathe fast and shallow, and that just tells the brain that we're in a stressful situation. So it perpetuates the stress response. So learning to control our breathing is really important. And a really useful tool is diaphragmatic breathing. This is all about consciously breathing to the bottom of our lungs. That pushes the diaphragm, the big muscle mass between your chest and your abdomen, pushes the diaphragm down. That makes your tummy stick out. But that fully inflates your lungs, and also the movement of the diaphragm actually reduces your blood pressure and slows your heart rate. So that's really important. And The best way to learn it is to lie on your back, on the floor, on the bed, put your hand between your ribs and your belly button. And then as you breathe in, you should see your hand rise up. And once you've got the technique, if you're feeling overwhelmed or really anxious, really stressed, then just do, say, 3 or 4 diaphragmatic breaths. In for 3, hold for 3, out for 4, hold for 4. And that will help to restore calm. The other really useful tool is the mindful exercise 5, 4, 3, 2, 1. So you say, ideally out loud, but also in your head's okay, 5 things I can see. And you look around and you engage with 5 objects and you name them. Then 4 things I can touch or feel. So you might be aware of maybe glasses on your face or a hat on your head or your feet on the floor, or you might want to reach out and touch things. But again, name 4 things. 3 things you can hear, and if you're struggling, you can always make some sounds. 2 you can smell, 1 you can taste. That whole process of engaging our senses helps to restore the rational brain. And also just think to yourself, what senses are particularly calming for me? For some people, touch is really calming. So actually they might just find just having something soft in a pocket or a nice sleeve that they can just touch is really relaxing for them. Some people may find that scent is, or smell, having some lavender oil on a cuff or the scent of your person that you love, that might be calming. So just think about what's particularly calming for you and try and have access to that. So that's us brought the temperature down to just below boiling. Reducing the temperature in the kettle completely is all about our self-care. This is about investing and nurturing in our mental, physical, and emotional health. And again, there's too many tools to give you on this, but mentally be very aware of being grateful for things. That positive mindset, that by attitude of gratitude, can be really helpful, and positive self-talk. Use positive, encouraging, kind words to yourself. When it comes to physical health, movement's really important, and obviously exercise, if you can incorporate that, is very helpful. Emotional health, doing things you enjoy, as I alluded to before. What makes you feel good? What gives you a pick-me-up, which you can do for a length of time, not just as a little few-minute thing. So again, incorporate that into your day, because that will help make you more resilient. And nature. Incredible tonic. So trying to incorporate nature into your day likewise can just help you improve your resilience. And that's the first part of my acronym STAN. STAN has 2 S's. The first one is self-care, which is that part. The rest I'll go through now. So the second S is to spend time with people who make you feel good about yourself. So the last thing you need if you're finding life tough is to be with people who make you feel criticized or judged, or who offload all their problems onto you. So spend time with people who can lift you up, build you up, and encourage you. T, talk to somebody. It's incredible how therapeutic it is to just pour everything out, to articulate all the thoughts that are going round and round in your head. It gives them more credence, it gives you something more to think about, and that other person who's with you might then help you look at things differently. So because you may have completely misunderstood a situation just because of your distorted perception caused by the stress response. A is ask for help. It might be practical help, or it may be emotional help. So it may be help in the workplace with some training on something, or whatever it is. It's such a sign of strength to ask for help. It's not a sign of weakness. It's a sign of self-awareness. It's a sign of knowing that you could be so much better than you are, and just trying to find the ways to feel better. And then N is no. It's learning to say no. It's the importance of boundaries. And again, many people, especially those who have people-pleasing tendencies, feel they have to do everything that's asked of them, and they put their own needs right down to the bottom and ultimately crash and burn. So actually being firm with yourself, like maybe the time you're going to finish work, you're very clear about what time you finish. It's also being firm with others and saying, please don't phone me between these hours. As I had a client actually once, her family were phoning her all the time for help and advice and everything. So we talked about this, and she basically said to them, don't phone between 4 and 7. That's when I'm putting my child to bed and having tea with him and things. And it was transforming for her. Likewise, a business client that was taking advantage, she kept just doing everything that was asked, not even getting paid. So again, she put in boundaries, and she found ways to make it very clear what she would and wouldn't do. And this woman just respected them. So have the confidence to put in boundaries, and that can be really helpful. And another tool actually that's helpful is the serenity prayer. Grant me the serenity to accept the things I cannot change, courage to change the things I can, wisdom to know the difference. The acronym CIA, control, influence, accept, says the same thing. We can spend a lot of time thinking about, ruminating over, worrying about things that we actually are not in a position to change. So this is basically saying focus your energy on those things within your sphere of control or influence. And I recommend writing down all your stressors, writing down everything that's making you feel stressed, and then circling the ones that you can do something about. And a classic example would be what we're exposed to on the news, social media, harrowing reports of awful things going on in the world, which can actually leave us feeling really uptight and incensed and all sorts of very negative, unhelpful emotions. And yet we can't do anything to fix it. So what can we do? We can donate to a charity. If we have a faith, we can pray for the people that we're worrying about, but also we can just stop watching and stop listening and shut down our notifications, our breaking news and all these things, and just say, right, well, I'll just listen to the headlines once a day and then that's it. I'm not going to watch anymore. So it's just trying to take control of things and focus your energy on those things. That can be helpful too.
Yeah. Oh, wow. There's so much good stuff in there. Thank you so much for sharing all those pearls of wisdom. I took so much from that and obviously connect so much to a lot of what you're saying as what I do as a coach. Particularly, I call them the spheres of control, because ultimately the one that's at the core of that we do have the most control is our stuff to do with ourselves. And
Yeah.
all the things you've said, they're all quite, what I like about them is they're quite small and simple things, but it's a
Mhm.
great thing actually that they are, because we don't want to add to people's stress by suggesting it's something that's, quite hard to reach and to succeed in doing for ourselves. And often there is a lot of wisdom in the simple things, but we can lose sight of them, can't we? Especially when we're in the thick of it, like you said, we're not really managing particularly well, so we lose sight of all these simple things that can
Yeah.
really help us. So I think you've given us a really great overview and some great things to try personally. I'm jumping ahead because I've got a question for everybody. I'm already going to answer it myself. The thing that I'm going to try, which was that breathing technique, which I really like the sound of. I've been listening to a few podcasts lately talking about the importance of breathing, because it's the one bodily system we can actually control. Everything else
Yes.
just does everything automatically. Yes, we breathe automatically, but you can interrupt
Yes.
it and do this really deep breathing, which I understand it allows you to access is it the
That's
parasympathetic
right,
system?
parasympathetic nervous system and the vagus nerve. And the
Yeah.
vagus nerve is integral to our resting state and calm. Other things that can stimulate the vagus nerve are singing and humming and chanting, which is why with yoga you see them often doing that. And that's what's happening. It causes vibration around the nerve, and that can actually stimulate the nerve. And again, slow your heart rate, reduce your blood pressure and things. Yes.
Oh wow, didn't know that as well. Another interesting takeaway. Thank you so much. So, question to end today's episode is, which tip or tool, and there's been many that we've discussed today, might you introduce to help you manage stress? Because I think one thing that we've probably identified from our conversation is that, I'm not saying that stress is inevitable, but the chances are we either have experienced it at some point and maybe not dealt with it as best as we could, so it'd be handy to know for any future occasions, or we might be experiencing it now in one way or another. But there are things we can do to help ourselves with that. So yeah, I'm definitely going to try that breathing technique. I love this idea that there's so many little things that we can do, and we can build upon them. Like you said, if you've got the small things, you can then build that in to be something that's take a bit more of your time, but it's something that you really enjoy, because it's often the thing that goes, isn't it? We let go of the
Yes.
things that we
Yes.
enjoy because we're trying to cram in all of the other things. And I'm a big fan of making time for ourselves. So thank you so much, and we'll share your details, and we've got some great resources to share, and put those in the show notes as well. So thank you very much.
Thank you. Thank you.
And we will see you all soon for another episode. Take care.
Thank you for listening to this week's episode of Mission Imperfect.
Please visit the show notes for details on how to contact us and for any resources we may have on the topic discussed.
Until next time, keep being imperfectly you. No one does it better.